Makoplasty is a form of robotic-assisted knee surgery that many feel is revolutionizing the way knee replacements are performed. Dr. Tarlow has performed countless robotic-assisted knee surgeries. He explains more.
We see a lot of people that have pain in their knee, and in that group of patients, when pain becomes something that preoccupies somebody's daily thoughts, gee, I can't do this because my knee hurts. I can't go here because I have a bad knee. When it gets to that point where it impacts how they live their life, those are the kinds of people we talk to about some kind of joint replacement. Partial knee replacement is the best thing that I do for people. They feel great, they recover fast, there are very few complications, and we can make their knee feel back to normal. Makoplasty, also known as partial knee replacement, is really a different operation completely. I mean, the only thing in common it has with a total knee is the word replacement. It's not the same operation, the recovery is not the same, the patient satisfaction is much better with a partial knee replacement. The partial knee replacement or Makoplasty patients don't just feel like they're better, they feel like they're back to normal. And that's because they have better motion, their knee rotates normally, we haven't taken out the ligaments that are important to guiding knee motion and having your knee feel normal. And it's not as a traumatic a surgery, so it's a smaller incision, everything's less invasive. We take that patient with arthritis in one compartment of their knee. We use planning that's based on a CT model. So we see a three-dimensional model of the patient's entire knee. It's patient-specific. I mean, there's no error. Once we've made the perfect plan, the robot allows us to complete the plan perfectly. And we map the patient's knee in the operating room to verify our virtual model. And then we're able to perform the entire operation on that virtual model and be more precise than we've ever been with any other type of surgery on a patient's knee, so that their leg is back straight, that their thigh bone piece tracks directly on their shin bone piece, and the tension, the balance of the knee, the way the ligaments are the way nature intended it to be. We do it through a small incision, and the patient goes to the recovery room, and from the recovery room they go home. Typically people will use a walker for 3 to 7 days. Typically they'll be driving within a week. Typically they go back to work in 2 to 4 weeks. In the end they turn out saying, my knee feels like normal again. It's very gratifying to hear that from a patient. My knee feels normal. You know, you've given me my life back. And we have a lot of Makoplasty patients that say, I'm back hiking, I'm back climbing mountains, I'm back playing tennis. Even some people are back running. I mean, they're back doing their normal life activities. If you asked me 10 years ago, do we do a good job with partial knee replacement or unicompartmental knee replacement with our standard instrumentation? I would tell you the answer is yes. But I think with the robotic technology and the Makoplasty instrumentation, we've not only improved our surgical technique, but we've advanced the whole treatment of the patient. We're doing a better job with pain management. We're doing this as a same-day surgery, which we've never done before. We never started to push that envelope and explore how we can use this technology to improve the patient experience until this robot came along. And so it's been an impetus not only to do the surgery better, but we're doing it through a smaller incision with less tissue damage, and now we're seeing how far we can go with it. And you know, I think the fact that the patients are on very little pain medication, that they're going home the same day, are things that are better for our patient, and that's a big deal.
We hope you've enjoyed